Next on primary care, caregiver burnout. Studies show that more than 60% of caregivers experience symptoms of burnout.
It's like I'm no longer able to function because I am so burdened by the things, the responsibilities that I have been given, and I feel like I don't have resources to take some of this burden off of me.
Hello and welcome to Primary Care, the show dedicated to improving the health of African Americans. I'm your host, Dr. Lonnie Joe. Caregiver burnout is the total physical, emotional, and mental exhaustion that can strike when you regularly give more than you have and are not getting the help or support you need. It's the result of cumulative stress and can hurt a caregiver's ability to care for themselves and their loved ones. According to a recent report published by AARP, caregiver burnout can happen when caregivers neglect their own health. 35% of caregivers in the report said that they put off dental or doctor's appointments. 33% delayed recommended treatment. 31% did not seek support when sick or injured. And 28% neglected to fill their prescriptions. Caregiver burnout can also lead to health problems like diabetes, depression, and heart disease. Joining us to talk about caregiver burnout is Dr. Gwendolyn Graddy. Dr. Graddy is a board-certified physician in internal medicine and geriatrics. She currently oversees the medical education at PACE, Southeastern Michigan, and speaks extensively on caregiving, aging, and work-life balance. Dr. Graddy, welcome to the show.
Thank you, Dr.
Again,
Jeff.
so good
Great.
to have you back.
Glad to be here.
When the caregivers we're talking about today are family caregivers who are unpaid.
Correct.
Couldn't the mere fact of not being paid contribute to or lead to the stress and the burnout?
Well, it can. So when we talk about family caregivers, you know, the term that they use are informal caregivers. So it can be family, it can be neighbor, it can be somebody from the church. And informal simply means that they don't get money for it. Now, I think the burnout is not just a factor of not getting paid. That can be a contributing factor. But I think it's also the fact that when a person is a caregiver, 100% of their time, in most cases, is dedicated to providing care for that loved one. So that is every day, all day, and often, not because help is not available. Often they don't know how to ask for help, they're afraid to ask for help, and in some cases, actually, there is no help available. So this is a growing subset of our population. As this country continues to age, we're going to see more and more informal caregivers.
But a lot of times the care that these people need are immediate types of care. I mean, if you're soiled or there is a need to do something on a more immediate basis for that patient, depending on how they can assist you or the state they're in, including where they're at. I mean, it's not like something can wait in a lot of these instances till somebody shows up. How's that affecting the care of the patient and challenging the caregiver?
So often the caregiver who is providing 100% care for that loved one, that's what they do. They know the person is going to have to be cleaned if they're soiled. They know they're going to have to feed the person. They know they're going to have to give them their medication. So they understand that that is a part of what they do. The issue is that it can be a source of burnout or stress for the caregiver. Typically, if the caregiver has a schedule, and many of them do because they've been doing this for a while, the person that they're caring for is not getting any less than they should get. They're providing everything they need, and that's part of the issue too, is that all of their time, all of their care, all of their energy is going into providing care for that loved one.
You know, I see patients too often, and the caregivers are saying, I need a break. I mean, what kind of risk are they running in terms of their own health and the conditions that they develop? Are they at a higher risk in terms of, say, for instance, depression or mental conditions?
Absolutely. So it's been shown that caregivers are at risk for certain conditions, one of them being depression. And one of the things that we need to watch out for, and I'm saying we because this can be the primary care physician or other family members or even the pastor at the church, is there may be signs that that caregiver is under stress. You know, exhaustion, they're not sleeping, their eating pattern has changed, they're depressed, they're becoming angry or anxious. And so when the stresses associated with caregiving are not addressed, that person is at risk. High blood pressure, depression, which is major because with depression, they really may not be able to continue to care for that loved one. They may not be able to care for themselves. So we have to be looking for signs and symptoms that that caregiver needs help so that we can intervene before it really becomes a crisis.
That's very important simply because stress can sneak up on you.
Sure it can.
It can also bring other elements with it, like you mentioned, especially depression. The problem is, how can we actually assist caregivers if we are paying attention and can identify those stressors or the things that are really creating more problems? How can we actually provide further services for the caregiver?
Okay. So you used a really important word, and it was how do we identify? And so that is also a role of the primary care provider, physician. When that individual takes mom or dad or whoever they're caring for in, part of that primary care physician's responsibility is to also make certain that they're finding out how they're doing. How are things going? What do you need? And then there are resources and things that are in the community that one may be able to offer them to assist them. So it starts with identifying that there's an issue. That can be the pastor noticing all of a sudden a person who comes to church every Sunday misses 3 Sundays. Get on the phone and call and say, Sister Betty, we haven't seen you for 3 Sundays. And that may be the way that you find out that Sister Betty is stressed. Things are going on with her mom and she feels like she can't leave. And one of her outs was being able to go to church. So we need to identify those, but we need to be looking for them. And we need to ask people, what's going on? What do you need? I'm here to help you. Tell me what you need.
Is there a difference in what we see from male caregivers to female caregivers? Now, the reason I ask is because my experience, it's been females that are taking care of the loved one or have the majority of the responsibility taking care of the family's loved one.
And traditionally, when you think of a caregiver, you actually think of a female, 48 years old, sometimes in that sandwich generation where they're still working and caring for the loved one. But what we've been seeing more and more is we're seeing more men who are also caregivers. Now, here are some of the challenges for men. They may not want to tell anyone what they need or what they're doing or what the issues or concerns are because, again, they feel like I should be able to handle this. I shouldn't have to ask for help. But they can also have some of the same stressors that you would see with female caregivers. The stress which leads to depression or can contribute or worsen existing medical conditions. So we are seeing more male caregivers, which is a good thing. But the likelihood of a male caregiver really saying, I need help, being able to share what's going on or letting somebody else come in to help them usually is limited. And part of it just has to do with the male feeling like this is something I should do. I shouldn't have to ask anybody to help me.
So now that the CDC is finally caught up with the rest of us and identified burnout with caregivers as a public health crisis, what tools do providers need to be using to assess this burnout?
Okay, so it starts with asking the questions. How are things going? Simple question. Simple question. The next thing is, it's not enough to ask the caregiver how things are going. Offer the caregiver some solution. Listen, you know, there's some adult day health programs that maybe we can get your mom, she can go there a couple of days a week. Or there are places like Hannah House, which is one of the places in the city of Detroit, or the Alzheimer's Association. So the provider, typically there's a social worker or some ancillary person in their office that can provide them some resources that they can actually use that will help give them, we call it respite, give them a break. But family members, please don't forget, if you know that one family member is taking care of your loved one and they're doing it 24/7, they shouldn't have to ask.
Absolutely. There should be sort of a team effort.
Yeah, it should be. And that's a discussion that families need to sit down and have. I'm going to keep mom on Thursdays from
Exactly.
3 to 10. You
Yep.
go to the movie, go get your hair done or whatever. So families also need to step in and do that. And also our extended families, which would include our communities and our places of worship, also
Sure.
become a very important part of helping caregivers.
Sure, I like to use the phrase that if one mother can take care of 5 children, 5 children can take care of one mother.
I love that one.
And, unfortunately, from time to time, thank God it's not often, but we find out that the caregiver is not doing the job. They're not rising to the occasion in terms of what the needs of the patient or is. At the same time, there might be some abuse there also. How do we look for those signs or symptoms in a situation such as this?
Well, one simple way is to see how the person that the caregiver is caring for, how they look. Are they clean? Do they have urine on them? Is there stool? Is their hair matted? Does it their oral care? So there's some really simple things that one can see just visibly that will let you know that maybe that person is not getting all the care. However, more times than not, the caregiver is really giving everything that they have to that individual. And if resources are limited, if they are burnt out, their ability to provide what their loved one needs may also be limited. So it's really important that we not accuse the caregiver of not providing good care, but let's find out what the issues are and make certain that we're providing the caregiver what they need.
Yeah, identifying the challenges.
Identifying the challenges and intervening, doing something about them.
Good.
Yeah.
And when we talk about this, are there any particular disease states that come to mind that would stand out on the patient's end, or also on the caregiver's end, that would complicate, or things that we need to pay extra attention to or highlight for the care of these patients and the caregiver?
Exactly. So one of the things I mentioned before is stress, which is a major factor, can lead to depression and exhaustion. But for the individual that already has existing chronic medical conditions, it can make them worse. So the person with diabetes, it can make diabetes worse. The person with hypertension, the person with cardiovascular disease. So any of those chronic diseases, which we see more in the African American community, can actually be aggravated or made worse by stress, which often these caregivers are experiencing. So it is important that not only is the caregiver taking the loved one to the physician to be cared for, but it's important that the caregiver is also being seen by a primary care physician so that they can have those chronic medical conditions managed and treated and kept under control.
So routine questions on an office visit should be directed to the caregiver about their own personal situation, irrespective of whether or not you are their physician or not.
That's exactly right. So while you're asking about their loved one, you can also ask the primary caregiver, how are things going with you? How have you been a good one. How have you been sleeping? How's your diet? So those are the types of questions that you can ask them, because that may open a door to begin a conversation for some things, resources that you can recommend for them.
It certainly does. I mean, you're talking about the patient, you inquire about the caregiver, and they break down in tears.
Absolutely.
You know, because the facade, the straight face that they're putting on, it all goes away when you redirect the attention toward them.
Yeah. When you let them know that, yes, I'm taking care of your mother, but I'm also taking care of you. I'm concerned about how you're doing too. That's so important.
Absolutely. What is sandwich generation caregiver?
Yeah. So the sandwich generation is a term that is used when you have a generation that's taking care of their children and their spouse, and they're taking care of their aging parents. And often that's the millennial generation, which I think the oldest age for the millennials is about 51. But what happens with that particular generation is they're still working, but they have a family at home. They have children and they have a spouse, and they're taking care of them. And then they also have these aging parents who have these chronic diseases, Alzheimer's, dementia, and they're taking care of them. And so what happens is, I sort of relate it to a peanut butter and jelly sandwich. They're right in the middle, and they're trying to do both, and it can be very, very challenging. Why? And the other reason that it's important to know that that's the case, so that you can also offer them some support and some resources. So that's what we call the sandwich generation.
So social services come into play. The stress of working 2 jobs because you're taking care of your family and taking care of a grandmother at the same time may impact finances in a home.
Yeah, there's no question, because unfortunately or not, often, especially in these African American community, their resources may be limited. And so now you have someone who has to take time off from work too, and that's where the Family Medical Leave Act comes in. But they need to take time off. They don't want to lose their job. So there needs to be resources that are available that allows them to care for that elderly parent and at the same time be able to keep their job. So yeah, there are resources available for them.
Unfortunately, legal issues can arise in these settings also. Are there any highlights that we need to be looking at to say, look, let's make sure that this checklist is addressed also?
Excellent. It is extremely important that there be a durable power of attorney. And the durable power of attorney is assigned not after the person is so ill or cognitively they really can't make decisions for themselves, but that person is assigned, like right now for you and I.
We
decide we need a durable power of attorney. And so you talk about a durable power of attorney, you talk about conservatorship, and then you also talk about goals of care as a part of the durable power of attorney. Mom, what would you want me to do if this happened? So it's extremely important. And the physician, the primary care physician, can start those conversations, by the way. And they're difficult conversations because unfortunately, we don't want to talk about death, because if I talk about it, it's going to happen. The reality of it is whether you talk about it or not, it's going to happen. So it's important to have those conversations early on, have that information documented, and have it someplace that if something happens, people know where to find it.
Unfortunately, too many people in the African American community don't have this kind of legal situation attended to, and then something happens.
Unfortunately. And sometimes it's because they don't know, and the other part of it is also denial or fear. I've heard people repeatedly say, I don't want to have that conversation about what happens if mom dies. We're not going to talk about that. We're not going to talk about death. But the reality of it is, when is a better time to talk about death than right now? So yeah, that becomes a real challenge often in our community.
What is respite care? You know, we love that concept and that idea, but sometimes it can be a problem in terms of providing those kind of services for patients.
It can be expensive. So respite care generally is the type of care that can be provided for your loved one where you have an opportunity to just rest or go on a vacation or whatever, and it's where care can be provided. It can be just during the day, it can be overnight. There are multiple sites where people can go for respite. Adult daycare programs can offer respite during the day, but there are also programs where they can stay 24 hours a day and they'll provide services. The Alzheimer's Association has something for respite care. There are other respite care organizations within the city, and even the program that I'm with, PACE Southeast Michigan, they also provide care for individuals who come into the program, and as a part of coming into the program, we can also offer respite. So it's just a break for the loved one, for the caregiver.
As you mentioned earlier, some people are still working and trying to juggle these balls also, a family, a loved one, and a job. We have the Family Medical Leave Act, which is supposed to support the caregiver to take care of the patient and provide some sort of protection in the workplace. Okay, what is the experience in the African American community with that? Are we doing it properly, or is it benefiting to the degree that we don't need to make changes, or is there room for improvement on that?
I think the room for improvement is knowledge. I'm not completely certain that everybody knows that that's available, but here's another opportunity for that primary care physician's office. It may not even be the primary care physician. You know that a daughter is the caregiver for an aging, ill parent. Offer them, would you be interested in learning about the FMLA? So I think we don't take advantage of some of these opportunities, Dr. Joe, because I don't think anybody tells us about them and we don't know. And so I think that there is an opportunity for more education that something like that does exist and that we should take advantage of it. And it should not be punitive. Your employer, this shouldn't be punitive. When you complete that, that says that if you need time off, you can take time off, and your job is supposed to be protected. So they need, because sometimes they're afraid if I miss so many days, I'm going to get fired. But that is supposed to protect your job as well.
So self-care is just as important for the caregiver as it is for the patient. The caregiver needs to be doing as much as they can for themselves and not having all the attention directed toward the patient. That is inclusive of hopefully having other help and support that allow you to do stuff like go get a massage.
Yeah.
Okay.
Exactly.
You know, to go run on like you said on Thursdays and okay, it's that sort of thing. Those kind of encouragements have to be part of what we do for caregivers.
Absolutely. And I would go so far as to say that self-care may be more important for the caregiver, because the reality of it is I've seen situations where the caregiver, because of a chronic medical condition or because of stress, the caregiver is no longer able to care for their loved one. Where does that loved one end up? In an emergency room, in a nursing home prematurely? So caregiver self-care is important, and the caregiver should not feel selfish because I'm going to provide some care for myself.
Right. Helping them understand that that is a necessary component of what we're trying to do here, and you taking care of yourself. I tell caregivers all the time, if something happens to you, I'm in trouble because I don't know how to manage this without you. I need you to participate, help me provide direction. It goes on, and making sure that they understand that you are appreciated is very important.
And I think it's important for them to understand that it is okay to have some self-love. You love the person that you're taking care of, and it's okay to love yourself. That's okay. And so we need to help them understand that you don't have to feel guilty or feel bad because I shouldn't be caring about the way I feel. No, you should be caring about the way you feel so that you can continue to take care of that person that you love.
That's right. It's the old airline, approach. Put the mask on yourself and then help the person next to you.
Absolutely. So put your oxygen on first.
Absolutely. So we kind of put together a little roadmap with this discussion. We need to talk a little bit about what is the downside, though, when the caregiver is not getting the support. Isn't there a direct connect in terms of eventually the patient suffering because lack of the services that are provided or information or support by the provider themselves?
So let's go back and talk a little bit about when the caregiver burns out, because it all really fits into the same bowl, as it were. Caregiver burnout is simply a manifestation of a caregiver's stress and all of the things that are associated with that, where the caregiver really is no longer able to function. That's really what burnout is for anybody, whether it's a physician or a caregiver or a parent.
Especially physicians.
Exactly. It's like I'm no longer able to function because I am so burdened by the things, the responsibilities that I have been given, and I feel like I don't have resources to take some of this burden off of me. It results in burnout. Now, when the caregiver burns out, we've got those chronic diseases that we talked about. So the outcome medically, psychologically, financially is that that individual really is no longer able to function along a number of different levels. So that's what burnout is. I can't do it anymore because I've been burdened. I've used all of my resources. I just can't do it anymore. And yes, ultimately, if a caregiver burns out, it will impact the care that the loved one gets, not intentionally. That's unintentional. There's an intentional, I'm gonna abuse you. There's an intentional, I'm not gonna provide the services that you need. And there's an unintentional, because I just can't do it. I can't even get myself up. So intentionally, it's not that, it's an unintentional.
These unintentional consequences may lead to the point of me crossing the line a little bit by saying, you really need to see someone about this issue. Even though I may not be the person for you to see, but it is incumbent upon us to cross that line because it's of benefit to your patient, who more than likely is going to suffer from not having this. Plus, it helps the caregiver.
It helps the caregiver. And it's important in that setting to also ask the caregiver, who would you like to talk to?
Or who your
Who
doctor
can you
is
go
even.
to?
Yes.
Or who is your physician?
Right.
Or who is your clergy? I'm going
Right.
to go back
There-
to the
there you
church
go.
because
Right.
the African American community, that's really important.
It's huge.
Who is your doctor?
That's right.
Who would you like to talk to?
That's right.
Are you already seeing a counselor?
Exactly.
So being able to offer them resources, or at least let them know that, you know what, it's okay that you're feeling like this. I understand you've done an amazing job caring for your loved one. Now you're tired. Let's see what we can do to get help for you. That's important.
You know, the point that you bring up about clergy being involved is very important, because in our community, we have people who will identify with a church and identify with a pastor or a
Yes.
church community, and they haven't been in a long time. Okay, they'll say, "Well, right," but when crisis time comes, who do they call?
They call the clergy.
Absolutely. So
Absolutely.
here again, that has to be on the radar of something that you can use as an asset in discussing these issues with caregivers and patients also.
It's another opportunity to take advantage of social workers or case managers, because they may also be able to connect that caregiver with some resources in the community, or they may be able to just sit down and talk.
listen.
Sometimes they just want somebody to talk to and not feel like they're being judged. I can't say I'm tired. If I say I'm tired, they're going to think that I can't do this, or that I don't really love mom. They need to be able to sit down and just be able to communicate, this is how I feel, and feel like it's a safe space to say it.
It's very important. What strategies can be employed to address these stressors? Should we be drawing on existing entities that we've been using for years? Should we be applying pressures in the right place to say it's time to step up, because this issue is getting worse for us?
Some of the strategies are really simple. Something as simple as getting enough sleep. Imagine sleep, the importance of it. We need 7 to 8 hours of sleep. I don't care what anybody says who says I can live on 4. We need 7 to 8. Exercise, adequate diet, being really careful about not overdoing the caffeine or the beer or whatever other drugs you happen to be using. I won't name all of them. So there are some simple strategies that individuals that can do that really will help them. And the other thing is, do not be afraid to become a part of a support group. And as a matter of fact, I even challenge some of my caregivers, you start the support group. Get a group of like people who are having similar challenges and say, let's get together once a week and let's just talk. Let's pray. Let's share a few Bible scriptures. Let's have some tea. And let's do what we need to do. So some of those are simple strategies that don't cost anything. Getting enough sleep, exercising, watching your diet, not overdoing it with substances. I think it really makes a big difference.
It has to. It's made a difference in all the other aspects of what we do for patients. It has to make a difference in this one.
I agree.
Yeah.
And it's holistic.
There you go.
It's holistic.
Dr. Graddy, thank you so much. Thank you for joining us again here on
My
Primary
pleasure.
Care. Our guest has been Dr. Gwendolyn Graddy, Director of Medical Education at PACE, Southeast Michigan. As many of you know, caregiving can be a meaningful and challenging experience. As you go through this journey, remember your health is just as important as your loved one, so please take care of yourself. For Primary Care, I'm Dr. Lonnie Joe.